Welcome to Germany, home to one of the world's most advanced and complex healthcare systems. From public and private insurers to specialized providers, the sheer number of stakeholders is astounding. If you're a digital health startup, it can feel like stepping into a maze. Hundreds of insurance providers, regulatory bodies, medical associations, hospitals, and more. Each stakeholder has his or her own rules and requirements. No wonder market access in Germany is notoriously challenging, with complex regulations, diverse reimbursement pathways, and numerous decision makers. For a passionate innovator with a brilliant health solution, this complexity isn't just daunting, it's a major barrier. How do you find the right contacts? How do you make sense of the rules and get your products reimbursed or approved? Many digital health entrepreneurs struggle to navigate this jungle and reach critical stakeholders early on. But what if you didn't have to go it alone? North Rhine-Westphalia, in short NRW, is Germany's most populous state, and it has your back. We created DigiHealthStart.NRW as a central one-stop shop to guide you through this journey. Think of us as your personal navigator for the German and NRW healthcare market. Our mission is to give digital health startups like yourselves a soft landing in Germany and in NRW in particular. We provide the knowledge, the networks, the support structures, and even funding opportunities you need to succeed. Here's how we help. First, knowledge. Through e-learnings and webinars, we break down everything from regulatory basics to reimbursement pathways. Second, networks. On our DHS platform, you'll connect with insurers, hospitals, research institutions, and fellow startups across Germany. Third, funding. We'll point you to grants, investors, and programs that can financially support your journey. In short, DHS brings together all the pieces of the puzzle so you can focus on what you do best, innovating. We are your one-stop shop for a soft landing in the German healthcare market, right here in North Rhine-Westphalia. Over the next 20 minutes, we'll give you an overview of the German healthcare system and show you how we make this complex system accessible. You'll meet our experts, Luisa and Oliver, who will demystify the German NRW healthcare landscape. By the end, you'll see that with the right guidance and support, even the German market, at nearly 500 billion euros in healthcare spending, is full of opportunity for you. So let's dive in and chart your path to success.
So hello everyone, we are here to navigate you through the German healthcare ecosystem. My name is Oliver Hilgers, I'm working for Regenoid. We are helping companies to achieve their CE marking for medical devices and especially medical device software. And with me is Luisa.
Hi everyone, I'm Luisa Wasilewski, the founder and CEO of PulseWave, and I've been working with digital health startups for like roughly 8 years, helping them to either enter the market, find funding, or work on strategic initiatives with pharma, insurers, and investors.
All right, thanks, Luisa. So the healthcare system, of course, is quite complex. Can you give us, in a nutshell, an overview about how this works?
Sure. So in a nutshell, the German system operates a mandatory health insurance, which means that everyone has to be insured. And the key stakeholders in the healthcare system are pretty much the patients, of course, then the payers, the insurance companies, and the healthcare providers. And the investors and regulatory people like the government and all kind of institutions are around that, or around the three key players. And if we first go and have a look at the healthcare providers, obviously this is very similar maybe to your home market, especially if you're an EU-based startup. So you have the ambulatory care providers, the outpatient clinics, the general practitioners, specialists. Then you have the second sector, you have the inpatient care providers. Those are typically clinics, hospitals. And then you have the inpatient and outpatient long-term care providers, such as nursing homes, home care services, usually for elderly people. And then you have, as a fourth and fifth sector, you have the pharmacies, and you have pharma companies, of course. And each sector usually has some specific regulatory things that you need to look out for. But we want to move on and talk about reimbursement, right?
Absolutely makes sense. And talking about the public health insurance, that might be one pathway. There might be different ones. Maybe you can guide us through this also in a little bit.
Yes. So let's talk health insurance. In Germany, roughly 90% of the people are covered by the statutory health insurance, like the government-based public health insurance. Those are in Germany income-based contributions. So the more you earn, the more you pay. However, there is a certain level where you stop paying more. It covers employees, pensioners, students, unemployed people, and also their families. It's highly regulated, but it's pretty much on a very large scale because it covers a large amount of the people in Germany. Which is what is kind of interesting in the German market is that we have a lot of statutory health insurance funds. We used to have way over 100. Actually, back in the days, we used to have 1,000 different health insurance companies, but today we roughly have 94 to 96. I say it like this because it's a constantly moving market and consolidation is happening pretty much every quarter. There's one insurance company being eaten up by another one. And then the smaller part of the health insurance is covered by the private health insurers. These are usually like 10 to 11% of the population. It's an individual contract, risk-based pricing. In Germany, it's either you have a higher income, then you can qualify for private insurance. You're self-employed, or you actually work for the government. So civil servants are mandatory in the private insurance. We roughly have 10 to 15 private insurance companies. And of course, as a third angle, you do have additional insurers, for example, for dentist staff, you can have an additional insurance. But this is seen as an additional insurance either to your private or to your statutory health insurance.
All right. So as we are in Germany,
Yeah.
there might be some specialties you need to know. So maybe you can elaborate on that one as well.
Yes. So as I said, statutory health insurance, the government base, covers roughly 90% of the population. But if you want to go the reimbursement track into the government-based funding pretty much, you also have to watch out for what insurance you actually need to go for. So we have the big funds, the classic health insurance funds that cover people that are employed and everything, and that do like the major bulk of all the care work and reimbursement track. However, if you are working in a case where you have long-term care, like for elderly people that actually need long-term care at home, then we have a special long-term care insurance in Germany for that. We also have a special insurance for people that go into rehab that are still working but need to go into rehab, because we have this saying in Germany that you always try to do rehab before retirement, and as long as you're still in an age where you can work, they will send you into rehab, which is paid by a pension insurance. And then as a fourth kind of track that you can go to is the statutory accident insurance. This is an insurance that your employer actually pays for the employees. It's mandatory by state law. And if something happens during the workday or on the way to work, this is covered actually by that insurance. So it's a little bit complex, but then not again super complex, because most of the cases are usually covered by the health insurance funds, the classic Krankenkassen.
All right, thanks a lot. So, from the perspective of a startup, what do you think? How should they approach this then?
Well, I think what's good to know is that Germany doesn't have a single payer, right? Even in the statutory segment, we have almost 100 different players. So it is important, if you want to go in the public system, which usually most of the startups try to do because it's a larger market, you still need to figure out how to get into all of these single insurance companies, right? There are bigger ones like the Techniker Krankenkasse. They have 12 million people that are insured with them. But there are also a lot of smaller insurance companies that have like 500,000 or even below 500,000 people insured with them. And those, obviously, this is a lot of legwork you need to do, and you need to decide how you're going to approach this. And also, the second thing you need to keep in mind, depending on your case that you're doing, as I just said, if it's rehab, if it's for elderly people, is it for people in the work setting, you might have to work with a different insurance company type. So understanding who pays for what is totally essential before entering the German market. But the good news is, once you have that figured out, you actually find a way in, you can access a quite a large market.
That makes sense. Thanks a lot.
Oliver, you are an expert on reimbursement. We just heard that 90% of the people are insured through the stationary health insurance. But what are the ways to actually get into the government funding?
Yeah, that's a good question. And there are many ways you can go for. You will talk about 4 today. These are I would say, the most common ones. So the usual 4 reimbursement pathways would be the DiGA, which is the digital health application. That would be the English word for it. And then we have the selective contracts. We have the ZPP, which stands for Zentrale Prüfstelle für Prävention. So it's kind of a prevention approach. And then we have the 4th one, it's called digital aid, so digitale Hilfsmittel. So these are the 4 common ones that you will usually aim for.
Cool. So let's start with the DiGA. What exactly is the DiGA?
Yeah, so DiGA, I think the easiest way would be to say it's a digital therapeutics. It's really an application that's intended to treat. There are also other purposes, but I would say this is the most accepted one from the German authority, that you can really treat. So that's why usually apps that aim for cognitive behavioral therapy are the ones that are focusing on the DiGA approach, and yeah, everything that's related to mental health is something where DiGA works the best. And that's why if you aim for this, you will also need a clinical trial and clinical evidence to make sure and to truly show that there's a benefit for the patients in terms of treatment.
Nice. So selective contracts also have something to do with treatment, right?
Yeah. So it's a similar approach like the DiGAs, but the selective contracts are something where you really focus on one of the insurance companies. You can go one by one afterwards, but you only aim for one first and negotiate and make sure that this app will be reimbursed by this specific insurance company. That's the difference to the DiGA. If you aim for a DiGA, you will have all the insurance companies in your pocket. But this, as mentioned, is a big effort. So you might also aim for the selective contract and go one by one, which could also be an option for you.
Nice. And let's move on to the 3rd one, the prevention.
Yeah. So yeah, as you already correctly mentioned, so not the DiGAs, but the applications that aim for prevention are something that can work as a ZPP. So it's like a Central Institute for Prevention. It's a different approach. The thing is that you also need kind of a human in the loop for this approach, where you create kind of a course, which is a 90 days course, which you will then provide to the people that are using it. And once you made it, you will get your reimbursement. Though it could also be one of the approaches that you aim for.
Nice. And similar to the DiGA, once you have the license or the certificate, you're being listed in a registry, right?
Correct. Yeah. And it's also something where you can go for the 4th one. It's called digital aid. So this is when you rather focusing on, for example, compensating on a disability, or really want to support already a treatment that you want to go alongside. It's a different approach. Again, something where you definitely need to show evidence, but the effort is not comparable to the DiGAs.
Cool. So in a nutshell, DiGA, all insurance companies, but long way, RCT study, or you go selective contracts one by one, which might be faster and easier, or you become an aid, a digital aid, which is even easier, but probably the use case is a bit more specific,
it's
right?
niche. Yeah.
Nice.
That's correct.
So those are 4 different reimbursement tracks, and you explained it great. But what about the medical device status? Do they need a medical device status for all of them?
Yeah, that's a very important question. I mean, we have talked about the 4 potential pathways, and each of them will usually ask for more or less evidence, and some of them will require mandatory to have a CE mark, so a medical device application. And there's one that by law asks for is, which is the DiGA. So there is definitely the mandatory need by law to have a medical device. So it could be class 1, 2A or 2B, so low risk or medium risk devices. And the digital aids are the ones that by law do not really ask for it, but indirectly you will not have a chance without being a medical device, because as mentioned, the digital aids aim for example, the compensation of a disability, which is usually a medical purpose and also requires a medical device status. So these are the two that really ask for a medical device. The other tools, like the selective contract or the ZPP, they are more open and flexible, so there is still a chance to go for it without being a medical device.
Okay, that was really helpful, but do you maybe have one more tip how to actually go and decide medical device, yes or no?
Yeah, so there are, first of all, what you can always do is there are guidances out there and they are free, so you don't have to pay something, you can just go online. And there's one you can go for, it's called the MDCG 2019-11. This is a guidance that contains a decision tree that tries to help you to identify whether your product is a medical device or not. To make things maybe easy for starters, there's some rule of thumbs you might take into consideration when you think about your product. Is it a medical device, yes or no? So the first thing, when you have a software, you always have to think about, does this software provide any kind of new information based on the input that the software provides? So is it only archiving, storing data? It might ask questions, and the questions and answers will be stored and displayed again. So if there's no transfer of information, no new information, just a display of the existing ones, very likely this is not a medical device. Usually a medical device software will take any kind of software information, like input information, and then will interpret this data and make something new out of it. So it must have kind of a brain, I would say, to really come to new data, new information. And secondly, of course, when it creates this kind of new information, is it for a medical purpose? So is this information for treatment, for diagnosis, for prevention? So there are different ways how this could be used from a software as a medical device point of view. So if this happens, then there's a high chance that your product will be a medical device. And yeah, double check with the guidance, and there's a good way to find this out. All right, Luisa. So to wrap up this session, so what would be your, let's say, final and most important tips for startups entering the German healthcare market?
Yes. So number one is always monetization strategy. We talked about this in the session. You need to really think about, do you want to be in the reimbursement track, for which insurance company, and be specific and try to really figure out how to get there and what you need from the regulatory side. Number two, market access. If you're an international startup, you usually don't have good contacts into German hospitals, into German doctor scenes. So you really need to think about, what KOLs do you need to get into the trusted inner circle, let's put it that way? And also, what kind of salespeople do you need? If you want to sell to hospitals, don't send a 20-year-old English-speaking person that doesn't speak hospital language. This is super, super important. And number three, find the right investor for the German market. You need an investor that understands that you're entering a highly regulated market and that things sometimes can take longer than maybe in your home market. So it's helpful to have the right investors on board to guide you with the right funding through this kind of complex market. Okay, Oliver, but from your regulatory perspective, what are your top tips for startups entering the German market?
Yeah, as we have learned today, I think the regulatory approach is super important, and it's very important to get this sorted out in the beginning of your journey, because you have seen in the pathways we have introduced that it depends on the status. Is your product a medical device, yes or no? Whether you can aim for the one or the other reimbursement pathway. So we have learned that, for example, for the DiGAs, you must be a medical device, while for others, like the ZPP, you don't have to. So, but you have to find it out in the beginning in order to set the pathway right. So have this in mind, check the guidances as explained, and make sure that you have the right pathway and the regulatory pathway done. We talked about this very often, that this is complex and difficult to aim for reimbursement. But Luisa, final question to you, is it achievable?
Yes, it definitely is. And especially if you have the right partners by your side. Maybe one last tip is also find people in the German market that will help you, that maybe have done it before, because they know what they're talking about. And don't be too naive. Be confident, but not too naive when you come here. And with the right partners and a good strategy, you can actually make it. And we also have some examples in Germany, right? We have Dr. Lieb, we have Tandem Health. Those are the leading digital health startups right now, and they're not German. So it is possible if you prepare right, have the right funding also by your side and the right partners.
Thanks a lot, Luisa, and wish you all the best.
Thank you, Luisa and Oliver, for that enlightening tour. So to all our viewers, let's recap the big picture. Yes, the German healthcare market is complex, but as we've shown, it can be mastered with the right support. And the opportunities are enormous. We're talking about millions of patients you could help, a robust system eager for innovation, and stakeholders who want new solutions if they're done right. Your next step? Join DigiHealthStart.NRW. We invite you to register for free on our platform. The moment you sign up, you gain entry to the NRW digital health ecosystem. That means access to our e-learning library, our directory of contacts, invitations to exclusive events, and updates on funding opportunities. Whether you're an international startup looking at Germany for the very first time or a homegrown project from North Rhine-Westphalia, we are here for you. Don't hesitate to get in touch with our team. Tell us about your innovation, your challenges, and your goals. We love rolling up our sleeves to figure out how we can help. Maybe by connecting you with a mentor who successfully launched in Germany, or by arranging a meeting with a local hospital interested in new tech, or by reviewing the steps you need to take for regulatory approval. So come on and join us. Let's shape the future of digital health together. Register now at DigiHealthStart.NRW and take your first step into the German healthcare market.